Hello and welcome. This is Dr. Sheila Kilbane. I'm an integrated pediatrician here in Charlotte, North Carolina. And for those of you who've been following this month, you know that it's been all about ears. And what I want to do this month is teach parents of children who have recurrent ear infections what I have learned about how to stop that cycle. So thank you so much for listening today, and thank you for taking the step to help learn what we can do for your children. I want to talk about three things today. First, I want to review what we've already talked about in the previous video from last week. Secondly, I want to give you another tip today, something that's really important on knowing when you have a child who has recurrent ear infection, and that's about diagnosing ear infections. The third thing I'm going to do is talk about the upcoming webinar. So I have a live webinar called All About Ears on how to stop that cycle, and it's going to be next Thursday, January 15th from 8:30 to 9:30 p.m. and I'm going to go at the end of this video, I'm going to tell you the different things that I'm going to cover. And don't worry if you can't make that time next Thursday, because the live webinar will be recorded and it will be emailed to everyone who registers after the webinar, and you'll have 2 weeks to watch it. What I want to get into today, and I'm going to tell you more about that again at the end of the video, and if you know you want to register, the registration is right below that video, so please go ahead and register. One of the first things that I want to tell you about today before we even review our old information, so I just want to give you a typical case so you understand what I'm talking about. Typical case of a child that I would see. So this particular little fella, we'll call him Johnny. It's a 2-year-old, and mom is now pregnant with her second baby, and she's realized that Johnny has had lots of ear infections, and she's starting to get concerned. So she brings him to see me, and as we go through his history, some of the things that we uncover, in addition to his recurrent ear infections, is that he has suffered from constipation for a good part of his life. He's had mild eczema. He had a little bit of reflux as a baby, and he's got some bumps on the back of his arms. That's called keratosis pilaris. And as I'm examining him and noticing him, I also notice that he's got some big dark circles under his eyes. So what that tells me is that he probably has a food sensitivity. So what we did for little Johnny is we took him off of dairy, because dairy is a very pro-inflammatory food, and there are a lot of people who have a sensitivity to it. And we added in a few supplements. So we gave him omega-3 fats, we gave him a whole food supplement, vitamin D, and probiotics. And I saw Johnny back 3 to 4 weeks later, and his symptoms were all improving. Constipation was completely resolved. The little bit of eczema that he had gone. The bumps on the back of his arms were decreasing, and the dark circles, they were still there, however they were improving. And that is a really typical case for the kids that I see. And yes, the kids eventually, they still can get 1 or 2 ear infections intermittently. It's not going to be that we're in the doctor's office every 1 to 3 months getting a really strong antibiotic to get rid of that ear infection. So now I want to go and I want to review what we've learned in the previous video before I go on and give you the tips I have about diagnosing ear infections. So what we learned last week is that there are 3 main things that are often overlooked when stopping the cycle of recurrent ear infections. That first one is food. And just like we said with Johnny, if kids are eating either a food that they're sensitive to, like dairy, or if they have a diet that's really high in processed foods, packaged foods, that is going to be very inflammatory for their system. And what that does is that inflames their eustachian tube. And their eustachian tube is that tube that drains the middle ear to the back of the nose and throat. And if that tube isn't working, anytime a child gets a virus, bacteria, or they get fluid building up in their middle ear, it makes it much easier for that to turn into an ear infection. So we really work and we clean up children's diets. That's the hard part. So what I ask families to do is a lot of work. So if you're looking for a quick fix, this absolutely is not a quick fix. So it's really a lot of work that I ask the families and the kids to do. The second component to that is allergies, and those can be indoor or outdoor allergies, and we're talking environmental allergies. So the indoor allergens are cats, dogs, dust mites, cockroaches, and mold. The outdoor allergens are trees, grasses, ragweed, weeds, the pollens of all of those things. And what I'm going to talk about in the webinar is how to figure out if your child has any of these allergies. Do you need to see an allergist? Do you need to get a skin prick test? Do you need to do blood work? What age can we check for allergies? So I'm going to go over all of those things in the webinar. There are things, though, that I want, right now, just listening to this, you can be aware of that. And parents often have pretty good intuition about, I think there is something that we're missing in these kids. So just keep that in mind. The third thing that we often overlook is anatomy. And what do I mean by this? So my niece Kira is a great example of this. Kira, when she was a little girl, so Kira has Down syndrome. So her anatomy is a little bit different than other children. And her tubes, her skull, the bones of her skull are a little bit smaller. And what happened when she was a little girl, my sister and her husband realized that she really wasn't hearing as well. And on one of her well visits, the doctor noticed she had fluid in her ears. So she had not been getting recurrent ear infections. And however, that fluid was hindering her hearing. And so Kira got tubes, and that was the best thing she ever could have done. So part of what I do with these webinars is to really educate people that sometimes tubes are a great thing. I mean, I have had plenty of patients where they get tubes and all of a sudden they're talking better, their balance is better, they're walking better. So it's not always, the beauty of integrative medicine is that we blend integrative and traditional medicine. So that's the third component of reviewing what we've talked about previously. The fourth point I want to make, and this is the new point that we haven't talked about yet, that is so important for parents to know, and this is for any parent to know whether your child has recurrent ear infections or not, and that is diagnosis. And what we know from studies is that ear infections are often misdiagnosed. What do I mean by that? So anywhere from 7 to 50% of the time, ear infections are misdiagnosed. So that means a child may have an ear infection and it's not picked up, or what more often happens is this child does not have an ear infection and they're diagnosed with it and they're given antibiotics to treat the ear infection. Let me give you an example of this. Typical Monday morning in my clinic, and one of the kids had ear pain over the weekend. And so in order to get it taken care of before the busy week starts, they go to one of those quick clinics that have popped up in a lot of different retail locations. And the clinician in the retail clinic says, yeah, the ear is red and he has pain. I think it's an ear infection and we should treat it. So they come into me and mom says, you know what, I just want to make sure, it's getting better. Can you just take a look at his ear? So, we go through the whole history and what's happening. And I take a look at the child's ears and they're stone cold normal. So what has happened here? One of three things. Either the child never had an ear infection, or the child had an ear infection and it went away because the antibiotics had started, or the child had an ear infection and it maybe was going to go away on its own with or without antibiotics. By this time, the family has now paid a copay to go to the quick clinic. They have paid a copay for the antibiotic, and they've started antibiotic, which antibiotics are great because they kill the bad bacteria in the ears, but they also kill the good, healthy bacteria in the gut. And they've paid a third copay now to come and see me. This was when I was working at my old practice. So when you understand the natural history of ear infections and how I don't want to say complicated, but how much is involved in diagnosing an ear infection, you are much more likely to go to your primary care doctor to have the ear looked at. So this is what I mean. Those people who are on the higher end, who are, the diagnosis is more like 50% of a misdiagnosis, those are clinicians who don't have a lot of experience looking at kids' ears. I have to say, it took me 2 to 3 years after residency in order to feel really comfortable diagnosing ear infections. And I always get a good chuckle when moms say, "Oh, I'm just going to get one of those otoscopes so I can look in Johnny's ears when I think he's got an ear infection, so that we'll know." And that's like me telling my mechanic, "I'm going to get a wrench and I'm going to fix my car when I know that it's broken." And I'm being facetious here. However, it really is. There's a lot of experience that goes behind knowing whether an ear needs to be treated or not. It depends on the child's age, the child's history, their anatomy, like I talked about, what their ear, have they been on an antibiotic previously, and if they do have an infection, that informs our decision about what antibiotic we're going to choose for the next ear infection. So my take home with that is, if at all possible, I want you to go to your primary care doctor in order to have the child's ears looked at if you are worried about an ear infection, because they are going to have the experience, they know your child, and they're going to be the best ones to help you decide if your child needs antibiotics or not. Okay, now we're going to get on to the webinar. One of the things that I'm going to talk about in the webinar is the natural history of ear infections. And when do we need to go into our primary care doctor? When does the child need to be seen? When is it safe to give the child pain medicine and watch them before you go in to see your doctor's office? When can you, if this is happening on a weekend, is it safe to wait until Monday morning to go see your doctor? So those are some of the things that I'm going to cover in the webinar. I'm also going to cover, we're going to go into more in depth about the foods. I'm going to show you a study that was done in the mid-90s on children with recurrent ear infections and food sensitivities. I'm going to go over the allergies, like I said, when to test, what age to test, do we get skin prick tests, do we need to see an allergist, how can we figure out if the child has environmental allergies. And third, I'm going to talk about supplements and about nutrition. So do we need to give the children any supplements? If so, what do we give them? How much do we give them? So I'm just going to give you some examples in the webinar of what I do with my patients. The webinar is next Thursday. It's live, so you can ask questions during it. I have a lot of information to cover, so we're not going to take a ton of questions. However, there are always a couple of really good questions that usually help clarify the information for everyone on the call. And it's from 8:30 to 9:30 p.m. If you can't make it, the call will be recorded and it will be emailed to everyone who registers for the course, and it will be available to watch for 2 weeks after the course. I'm really excited about this, and all of this information, I had told you previously that understanding this information really helped make my professional life so much more satisfying, because I feel like I'm helping families get to the root of children's illnesses. And I really, this portion with ear infections, I really stumbled upon it as I was beginning to learn about integrative medicine and nutrition. So I'm so excited to share all of this with you. And my goal for this particular webinar is to reach at least 250 families. So if you know anyone who can benefit from this information, whether it's a friend, a family member, a physician, if you think your doctor might be interested in this information, a colleague, somebody who has a child with recurrent ear infections. This also applies with recurrent sinus infections. Please forward this video, and all you need to do is go to my website. For anybody who's new, who's watching this, go to my website, sign up under the newsletter with your name and email address, and then you will be on my list to get further information. Also, please help me spread the word about integrative medicine and nutrition by going to my Facebook page, Sheila Kilbane MD, and just liking it, and we'll get the word out there. I do individual consults out of my office here in Charlotte, North Carolina. So if you live in North Carolina or Charlotte, please feel free to call the office, 704-708-4404. However, the reason I do these webinars is because I have so many families ask me, could you talk to my sister whose child has recurrent ear infections in Oklahoma, or could you talk to my best friend from college who's in California and her child has recurrent ear infections? And I realized I needed to make this information accessible to anyone who's interested in having it. Thank you. I really appreciate your time, and help me spread the word, and have a great day.